and that is Ekikrit. And that's going to be Viresh Garg. Viresh is a veteran in the software industry with experience in both high-tech products and services strategy, marketing, sales, and delivery. Most recently, he led the strategy, product, and operations for a health tech organization. Right, inspired by his personal story of being able to live his full potential thanks to the integration of modern and traditional medicine. For his mental health situations, he is deeply passionate about the opportunity to deliver his kind of success to everyone. Welcome, Viresh. We're excited to see your presentation.
Dr. Uli, thank you very much for giving us the opportunity to introduce our dream, the concept of Ekikrit to everyone. My name is Viresh Garg. I'm founder of Ekikrit. I got the inspiration for this movement from my own personal experiences. I was amazed by the success of the integration of modern and traditional and integrative medicine in my own personal experience. In contrast to the historical mental health issues that led to resignations, being sent to psychiatric facilities, now after integration, I've had no major incidents, and I'm aspiring to create a leading health tech company focused on making my kind of success available to everyone in the world for all chronic conditions. Let me explain the meaning of living up to full potential, which is our tagline. On February 27th this year, 2024, was the 25th anniversary of my marriage. I was married to a very fine woman, almost a goddess-like woman, but I was living the life of a gay in closet. If I did not find, if I was not founder of Ekikrit, it will be extremely hard for me to have the confidence and courage to come out. So living up to full potential for me means that, integrative medicine has enabled me to come out as gay. In the global world, everything good becomes globally accepted quickly, just like COVID spread throughout the world quickly. So we researched why traditional and integrative medicine has not been able to make a global impact in the Western world. Here are our findings. One, we found that the vendor providers of integrative solutions like dietary supplements, superfoods, online yoga and meditation and meals, it's a very, very mature market and it's a very crowded market. The market does not need any new vendors to be building more dietary supplements, more superfoods, and more online yoga. It is very, very clear that there is a strong need to digitize the provider and user experience for integrative healthcare to enable higher adoption and embracement. Second, the reason the goodness of dietary supplements and superfoods is not even remotely fully realized in the Western world is the lack of safety information for their interaction with modern medicine, each other, and their contraindications with health conditions. In lack of this data, modern medicine doctors are very skeptical to recommend them, and the users find it hard to trust the broad spectrum of integrative providers like functional doctors, traditional doctors, dietitians, chiropractors, and everyone else, that wants to, push, users towards naturopathy. Overall, integrative medicine market for lifestyle diseases, mental diseases, and preventive wellness. We have chosen these three because these are the three key things happening in America right now. Lifestyle diseases are at rampage. Mental, issues are extremely alarming, and preventive medicine, has to be at center of reducing the overall. I think Dr. Uli always talk about per patient, total like lifetime cost of healthcare, on a patient that can only be reduced if preventive medicine is, very, very aggressively employed. So when we focus on just those three aspects, our solution will include all diseases, but just three aspects. If we consider that out of all the diseases, people that have lifestyle diseases, mental diseases, and preventive wellness goals will spend $100 per year on integrative medicine, which means buying 2 bottles of ashwagandha from Costco. People buy 12 to 13 for one person in their family. Just $100 per year accounts to 38 billion in USA, and the worldwide market size is expected to be 300 or 275 billion dollars. Harvard, Stanford, UCLA, and many other premier institutes now offer academic programs for integrative medicine. There is also board certification for integrative medicine. Institutes like Andrew Weil in Arizona and Maharishi University, Dr. Robert Schneider, the dean there is one of our medical advisors. Um, they offer MS in integrative medicine with focus on Ayurveda, the Indian traditional system of medicine. These are just some of the examples. A lot more is happening in the entire world as far as integrative medicine is concerned. So let's talk about our solution. But before going to the solution, let's recap the problem again. One, there's lack of automation and digital platform for integrative medicine that is at par with modern medicine. There's so many EHR, EMRs. I go to Palo Alto Medical Foundation. They always use Epic. From my research, I've seen a lot of traction for Athena Health, Dr. Chrono, Charm Health, and there's so much digitization that is available for modern medicine, and there is none for integrative medicine. So, lack of automation and digital platform. And then the second thing that we talked about was safety. So of course, our solution has to be something that addresses, the key gaps that we have identified that I consider are the barriers to entry for the integrative medicine in America. So the way we are addressing these three issues is, number one, we are redefining wellness to be focused on understanding users' unique risk profile. And when generally in America, when you talk about wellness, I think people talk about weight management. I think people talk about adopting active lifestyle. I think people talk about having some kind of daily regime or discipline, to de-stress yourself so that you don't develop mental health issues. Beyond that, wellness is not defined as per the unique needs of every individual. So the first thing that we are trying to do is to redefine wellness to be focused on understanding each user's unique risk profile and then preventing those diseases that are considered in the risk profile from happening. Number two, we will create a single marketplace for all integrative products, starting with supplements, yoga, meditation, and meals. And number three, we are building world's first safety database for all integrative therapies and world's first software to provide inline recommendation to the doctors. I have studied in detail. I have only studied one of the EHR EMR that I will not name right now. At least in that EHR EMR, I did not see inline safety recommendation given to the doctor, where all the previous medicine that the patient was taking was considered. And before doctor would release the script, the software will stop doctor because it may be interacting with another medicine that the patient is already taking. So not only are we building a modern safety database of all the herbs, we are also understanding all the modern and traditional treatments currently employed by the patient. And we will never let doctor release a new prescription that interacts with them or can do additional harm to the patient. So let me talk about marketplace a little bit. I was deeply moved by my fellow peers and industry leaders, the founders of Uber and Airbnb. Unlike many other marketplaces that are just trying to use someone else's platform, someone else's code, someone else's warehouse, someone else's shipping service, and their only goal is to reduce the operational cost so that they can be price competitive. That's one concept of marketplace. But when Uber and Airbnb came, they completely redefined what marketplace means. Number one, they focused on the common man of America. They made everyone entrepreneur. Anyone that owns house, anyone that owns car can be entrepreneur now. So they focused on a market segment that was never even thought about. And number two, they built features that promote safety, and other kind of review and rating and things like that, created an environment where at least I feel significantly safer in an Uber ride than I ever felt in Yellow Cab. So inspired by that, we have also tried to focus on not creating a marketplace which is just an e-commerce site. We're really striving to create value addition from the marketplace so that the users can go to 10 places, 10 marketplaces, and if they want to be price competitive, they can probably buy it from many other sites. But when they will come to Ekikrit, the value they will get will be the value that we all get from Uber and Airbnb. Just to give some examples, our value add, focuses on 3 or 4 things. Number one, safety information at par with modern medicine, which you cannot get from Costco, which you cannot get when you buy dietary supplements from Amazon. Second, we capture the most comprehensive medical history, because for the safety calculation, you have to capture anything and everything that could be related to safety. We did a lot of research and we found the intake form of John Hopkins Hospital to be most comprehensive. And our medical history intake is 3 times deeper and wider than John Hopkins. In addition to that, when users buy dietary supplements from our platform, we give them access to yoga videos for free. We give them diet recommendations for free. And there are many other features, that, I would love for you guys to follow up with my team. In chat, you can, ask your questions. I think we are providing, when we looked at the value that we are providing to the users, if we did not have marketplace, when I compare the membership charges from companies like Calm or other healthcare companies, we valued our membership to be around $150 per month. The EHR and EMR capabilities, that we are building, which is all patient history and doctor recommendation built into it for integrative medicine. It's a simple 5-step process. Number one, we focus on understanding users' full medical history, past, present, and risks, symptoms, current medicines, understanding the goal for integration that the doctor and user agreed on. Then we provide rule-based recommendation in software. Right now, we do not have data in terms of what kind of dietary supplements, when integrated with modern medicine, will work best in what scenario. So our first 2-3 years are focused on employing best rules that are at, modern medicine and Ayurveda experts are designing. But the idea is that over a period of time, 2 to 3 year time, we will have enough statistical data that we can then do a combination of rules suggested by experts, as well as AI, ML, analysis and pattern recognition that we can find just because we have volume now. So the last thing that I want to mention in terms of our value add for EHR, EMR capabilities that does not exist in modern medicine either is we strongly believe that one of the things that is wrong in the field of healthcare is that I only go to doctor when I need to, when I'm so sick that I can't function anymore. Now you have to go to the doctor. But, even people that have chronic conditions, they would generally call the doctor and get their prescription renewed. It will be months and months and months and sometimes years before they will actually physically visit the doctor. So the best thing that we can do, in terms of value add of marketplace, is to foster an environment where the doctor and our users, they have to participate in a lifelong dialogue. The lifelong dialogue is focused on the dream of living more life. The life expectancy should continue to increase in America. And when life expectancy is increasing, when you think about geriatric population, let's say above 70, 75, we want the organs to be as healthy as they were at 60. So our focus is for everyone to see that dream that I want to live that life. And then we will help them, how to achieve that by fostering lifelong collaboration between doctor and patient. So I want to focus on our model is B2B2C. We do not go to consumers directly. We strongly believe that the healthcare belongs in the hands of doctors. Uh, there's no e-commerce site that can decide that based on 3 or 4 questions that the user answered, what dietary supplements or what kind of Ayurvedic medicine will work best for them. So we strongly believe that in medicine field, you're always navigating in some shades of gray, and the doctor can never be eliminated. So that's why we have chosen the model to be B2B2C, because we believe that if we can convince the doctors to use integrative medicine, when they will recommend, I think the sentiment that I've seen in America is that, every users really trust their doctors. They have given the custody of their healthcare to the doctor, and they blindly trust them and they listen to them. So we are focused uniquely on just winning the confidence, trust, and respect of doctors rather than spending millions and millions on marketing to consumers.
Viresh, time check.
Okay, I will just take 1 or 2 more minutes. So providers, they will get much needed automation missing from the integrative healthcare in terms of EHR, EMR capabilities. And they will be able to review the best fit products for their users from the vendors that are already onboarded in Ekikrit's marketplace. The fitment data, which means that which medicines or which herbs work best in what disease. The beauty of our solution will be that because we are going to incorporate rule-based engine and artificial intelligence together, we will be building a system that will always be growing and that will always be evolving, and the evolution will never end. As far as users are concerned, they get the best healthcare for their chronic conditions. I already talked about the dream of the maximum life expectancy and healthy organs in the geriatrics population. And I think there is no better way to describe it than to say that that's what they need to live up to their full potential. There's a lot that must be done. So we talked about safety, safety, safety. I wanted to just highlight one slide in terms of the amazing work. I was just amazed when I did this research of how much work goes in every modern medicine when it comes to safety. 10 years of clinical trial, and there's so much focus on what needs to be done for safety. My favorite on this one, this I could not ever imagine, was that whenever a new modern medicine comes out, that literature, the medicines literature always talks about what are the symptoms of overdose, and the emergency room doctors are always prepared to deal with the overdose of that.
All right, Viresh, it's time to wrap up. Thank you. Let's ask people if they have any questions. How do you make sure that the doctors are going to pay for this? Who's going to pay for this? Who's your customer?
Yeah, so that's a great question, Dr. Woolley. What we are trying to do is to enable, an environment where all medicinal systems of the world are employed in the most optimal way. And when you do that, you will have ample opportunity to make revenue from so many different angles. So as far as doctors are concerned, I think our focus is to win their trust and respect by showing them the science behind integrative medicine. And by taking the fear of it's not included in FDA or CDC guidelines away. So we're doing everything, for the doctor community in that area. And I will talk about that in a second. So
no, the question is, who are your customers? Who is paying?
So there are 4 revenue sources. Number one,
okay,
when the doctors recommend dietary supplements, if the patients buy those dietary supplements from our e-commerce, from our marketplace, then in addition to the value of getting the supplement, I talked about all the other things that we give away for free. So the first revenue source is the sale of dietary supplements, superfoods, meals, and other integrative medicine products on our platform. The second revenue source is that whenever we are also sort of employing disease-based yoga concept rather than just wellness-based yoga. Where for each disease we have chosen different yoga protocols and different yoga modules. So the way users will employ yoga in their life is number one by having videos, and number two, we will provide online yoga sessions. And those online yoga sessions will also
How do you
be
get
in the way
paid?
of marketplace.
So you sell it on
There
the
is a,
marketplace.
yeah.
Okay.
Then the third one is the referral fees, because we are creating an environment where the patients and the users will always have awareness of where their life is going. Are they going to live above 90? Are their organs going to be healthy, right? We will focus on these kind of questions, and we will create an environment where we will
So the patients
have
will
more
pay?
and more users become health sensitive. So when those users will go to doctors, it will be Ekikrit's recommendations. We'll make referral fee from doctors. And last but not the least is the membership. If someone still wants to buy dietary supplements from Amazon or other marketplaces, we absolutely welcome them to do so. In that case, all the features that we give away for free in our marketplace will then be charged to those users from membership. So those are the four revenue sources. As far as
Okay.
EHR, EMR capabilities are concerned, we give them away to the doctors for free.
Okay. Well, there may be some legal implications about referral fees, but Margaret, you have a question. Margaret, go ahead.
I actually have a very quick feedback for I think pronounced Viresh.
Viresh,
Yes, Viresh, I just have a quick feedback and thank you for, presenting such a complex, I think, workflow here. But my suggestion to you is you spend a bit too much time on, how it works and the issues. You may want to kind of simplify that for the audience in the future. Otherwise, it's
good
very
point.
challenging for you to pitch in a short
No,
time.
I think
Good
I
point.
strongly disagree with that. I think if
Okay.
my pitch is interesting, then I will do what I will do in 15 minutes, and people will come back and they would want to know more. But thank you so
Okay.
much for your feedback.
Sure. Thank you very much, Viresh. Let's go on to Dr. Agarwal, Shaili Agarwal question.
Yes. So my question was, hello, Viresh. Hope you're doing well. How will Ekikrit generate more opportunities, no, for doctors and patients around to do a long time collaboration, maybe? So what's the idea about that?
You may be muted, Viresh.
My most favorite question, and I get muted. So, software industry went through a transformation when cloud was invented. The largest companies of the world that took so much pride in spending millions and millions of dollars over a period of so many years in terms of building resiliency in their IT applications, when they saw what Amazon, Google, and and Azure could do, they all were forced to adopt cloud first strategy. Right, more and more customers are moving towards cloud, and cloud has become such a global phenomenon. The reason cloud was so successful was because observability was at the center of cloud. What does that mean? Whenever Amazon deploys any open source product, the first thing that they do is to figure out how will we monitor it, and when things will go wrong, then in an automated way, how will we fix it? So in a way, what Amazon, Google, and Microsoft did was to give software more life, more health, more life. So when observability was so important there, we have taken the same theme in terms of the value that we will provide to doctors and users to create an environment for lifelong collaboration. What does that mean? When we think about our health, there are some things that we always know. For example, we know that my diabetes is defined by A1C number. I know that my bipolar is defined by the number of episodes that I'm having in depressive phase or manic phase. So some things we already know in terms of alarms for health, but there are some things that we just don't know. I'll give an example. Let's say, my granddad, uh, let's just imagine that, he had rectal cancer, right? Rectal cancer is a disease, which is hereditary disease. So my risk for rectal cancer is high just because someone in my family had it. But what I don't know is that if I will stop doing exercise, then that risk, increases 10x, right? So there are so many things in our sort of, day-to-day life that we do, that can be captured quantitatively as data. That very similar to how observability is done in software, right? If you consider the human body to be a server, then we're just trying to monitor everything that is going on in the human body. And based on that, we will always find early alarms, problems, and things like that, which will prompt us to connect the users and doctors together.
Thank you, Viresh, for that presentation. And you